Yeah, as you can see, I'm from the University of South Australia, Australia. Probably I'm the one that's the longest traveled delegate in this conference, probably. And I teach medical sciences for medical students as well as allied health science students. Okay. You know, if I go back a few years ago, when information was not easily available, when I was giving a lecture, the lecture hall was full. Even if it was cold outside, raining, the lecture hall was full. But now, the lecture time, prime time, maybe 9 o'clock, 10 o'clock, the attendance is dropping down. Hardly any students coming to the lecture. And that is true in many universities. It's not just our university. And so we really have to listen to students. Why they were coming before, why they are not coming now. So that means students are telling us, they're giving messages to us, the way you teach is not right. We want something different. But we are continuing how we used to teach before, even now. We got to change. And if we put our recorded lectures on the web, they are connecting, they are listening, they are engaging with the information that we provide using technology. So the students connect not only with the content, they are connecting with their peers. They are connecting with the teachers. We have the discussion board these days, the forums, emails, they are connecting more than they were before when they used to come to the class in person, face to face. So we need to do something. So where students cannot learn the way we teach, is our responsibility. We should teach the way that they learn. I think this is important. We can't just continue how we used to. Why we need to change the way we teach? First, students' demography is changing. My students' age brackets used to be first years 16 to 19, but now 16 to 60. Demography is changing. The way they learn is different. Info obesity, there is so much of obesity of information. Those days, if they need some information, what I'm telling, they got to be in person in the class. Otherwise, to get that information is really hard for them to go to the library, find, it's not easy. But there's far too much information available at our fingertips. So we need to change. Time poor. The 19-year-olds, they're too busy. They got to go to parties, they have to socialize. To socialize, they have to work. Earn money, spend money. Their priorities are changing. Now people are getting richer. You know, their priorities are changing. And the mature age students who are in 40s, 50s, they have families. They have to take care of the children. They're time poor. Youngsters are time poor. The elderly, older students are time poor. Time is precious. And access to, as I said before, access to technology. Almost, when we did the survey, almost all students, they have their laptops or iPads. Too much information and varied learning styles with different demography, very different learning styles. And those days we give them lecture notes, go and learn. Give them textbook chapters, go and learn. But now we are, as teachers, we are learning about their different learning styles. Some are, they want to learn themselves, some are they want to learn in groups, some are visual, they don't want to just listen to your lecture, they want videos. So things, learning styles, we are learning, and so we have to provide different learning styles for students. But how can we? That's the point. Students' engagement is important aspect of learning. If students engage, if students involve, they learn better. How do we do that? So engagement. Engagement. Students contributing in groups, that's engagement. Using lesson resources, however, maybe recorded lectures, whatever, that's the engagement. Becoming active learners, that is engaging. And by engaging, they become active learners and participating in the discussions. But at the end, whether students are in front of you in the classroom or not, how does that matter? What matters is this, whether they are achieving their goals, the learning objectives, are they getting that? That is the important point. It's not that taking attendance every day doesn't really matter if they're here or not. But for clinical skills, that is completely different. So the content, the content, we use PowerPoints, put it on the web. The videos, short videos, again, the students' patient level is decreasing. If you post a 1 hour lecture, 45 minutes lecture, they're not going to listen to you. So short videos, the shortest video I have on lecture, 5 minutes. It can vary from 5 minutes. The maximum lecture, my length of lecture is 20 minutes. That's the maximum. Even if your students are in front of you giving one lecture, I bet how many of you are following. You know, after 5 minutes, they're dreaming. You're wasting your time. So the content can be using technology, and collaborative learning, I think, is absolutely essential. You know, learning from each other, peer learning, and we have to do, that is our job, to provide that opportunity for students. Hands-on experiments, you know, going back a few years ago, doing blood topic, you know, blood grouping. Students got to be in the lab, prick their fingers, get drop of blood, and do the blood grouping, find out what blood group is yours. But now, we don't do that. Okay, we provide the experiment through technology. It doesn't have to be your blood. Okay, your blood, you can assume, okay, you are A. Okay, when you go to the lab, for some reason, they're going to do anyway, but this is a learning process. So using that technology, they can find out how to work out what blood group is that. And then if you're working in groups, 10 students, okay, can you give your blood to that student? And why not? They have to discuss. Not in the classroom, somewhere else, using technology. So they can do as many times as they want, and until they understand. Otherwise, they do in the class, they go home, what did I do? And I forgot. So using technology, engage, group work, participation, I think is important. And exams, again, I think, you know, we give materials to students, and then in a big hall, we give exam questions. In a big hall, they sit and regurgitate what you gave them, the information. So I think even that is not really important. Exams are, you know, it doesn't have to be that way. The exam can be all their learning, they have to, we have to assess them. Even when they're doing assessment, they must be learning. That's what I'm saying. Online learning, group assessment, individual assessment, they can still do the assessment, all their learning and getting feedback. Okay, all their learning, getting feedback and doing assessment, I think is important. So no more gurus these days. The guru is gone. Okay, now guiding, facilitating students, I think that's what is important. So goals to achieve: create curiosity to students, avoid info obesity. Goal to hook and motivate learners to want to learn more about the content topic at their own pace, not the pace that we want them to learn, at their own pace. Again, I think that's very important. And also If I'm teaching medical sciences, if I'm teaching them, for example, antibody, antigen, or about atom, students can't see the relevancy. If it is not relevant, those days, students never used to ask, why do I have to learn? They never used to ask that question, but now students are more confident and they ask you questions, why do I have to learn? Why are you teaching me this? So it's really important to show them the relevance. If we show them the relevance to their future profession, more likely they will want to learn. We create curiosity in them. Otherwise, they just learn because you have to learn and do the exam. That's about it. So the teachers need to, that is their role, teachers' role, to show them the relevance. Use the method where you can show the relevancy. Collaborative learning. I think the information we give is like a big piece of puzzle. If I'm teaching multiple sclerosis, it's a puzzle. There are so many pieces, and some students got some pieces, but they don't know where to put. Maybe another student can show where to put. So collaborative working, doing collaborative work, you can finish the puzzle much quicker than learning by themselves. Okay, each piece and putting that in one piece at a time is going to take ages to learn for the topic, one topic. So collaborative learning. Again, completing the puzzle, collaborative learning, and while you are learning all this material, collaborative learning, while they are doing it, they have to they have to monitor their progress, how they're going at every stage. It's really important for them to monitor from the beginning. And also in the classroom, when we have by the way, talking about online and technology, students don't like full online. Students don't like full face-to-face. They like blended learning. Okay, so when we have some face-to-face interaction with students, we can also monitor students' progress. Students can see their progress, as well as staff can see their progress by using, there's so many software these days. For example, the one that I use is Socrative.com. So when I have face-to-face with the students, then the students already have the information. Students already told me what they want to learn. Students driving me what they want me to teach them. So only those concepts I interact with the students, and even then I use the Socrative.com software to see how they are going in the topics that they had difficulty with in the first place. But more than anything, I think they should have fun, and only then student success. So increased student engagement comes increased learning. One case study I thought I will just share it with you. We have pathology museum in our campus. In this pathology museum, we have 500 specimens. Too many. Okay, 500 we have them. And previously, we used to take some of those specimens and ask students to examine, and staff member would show the structures of these specimens. And then at the end, they have exams on those specimens. Last 3-4 years, we changed this system. So instead of 500 specimens, we looked at the top, the priority, the most common disorders students may come across in the hospitals. We picked 30. One example, stroke, heart attack, kidney failure. So important topics, we picked the top 30, and for each of those topics, each of that cases, we did the digital information on that condition. So this is the heart condition, this is screenshot, so you won't be able to see, but if students highlight that one or they put their cursor on this, the structures will show on this heart. So all the structures they can learn anytime, and this is the real case scenario. The terms that students may have difficulty with, we highlight those, we give the meanings for those terms, and then normal heart, they can compare with abnormal heart, and the histology and questions for them to check their understanding. So there's more information for students, and there's a lot more information in just a few screenshots here. And then instead of me giving a lecture to students, I record the lecture on the heart or whatever it is and post them. That's all information they get from me. The rest is students' responsibility based on the information I gave them here. And then they come and present, the students come and present in the class. And this case is on lung cancer. They are imagining, it's all, I leave it to them, the imagination. They can bring it, they can present any way that they want, but they have a format, they have to follow the basic format, the rest is up to them. They come with all sorts of imagination the way that they want to present. So Albert Einstein, he was a smoker apparently, so he got lung cancer. So what is important here, I teach pathology, and to understand pathology, they need anatomy and physiology. Without that, they won't know, and they can't really understand pathology. They would have done anatomy, physiology in first year. They have to bring that knowledge from first year, integrate with pathology. Normally, students, they forget what they did in first year, it's all gone. But they can't do that here. They have to bring the relevant information. Here in this case, lung cancer, they have to bring relevant information from first year and present here, they have to learn. And also what they will be learning in fourth year, fifth year, these are imaging students. Fourth and fifth year, they will be doing MRI, CT scan, X-rays, whatever. They have to think, they have to predict, okay, this person has pathology, the lung cancer, what kind of imaging techniques do I need to use in the future? So I'm going back again, pathology in the center, anatomy, physiology, they would have already done, imaging they will be doing in the future. So they have to bring information what they have learned before and what they are learning now and what they will be doing in the future. It's all like a package. And this is all students will be doing. I didn't tell them. All I told them is about what is lung cancer information, pathology information. That's all I gave it to them. The rest is up to them. And I'm only showing bits and pieces here. So this is the evaluation from students, motivating factors, learning pathology this way, the one that I just showed you, integrating anatomy, physiology, teachers showing application and relevance to medical radiation, and real-life human pathology specimens with real case studies, and group clinical scenarios, and using medical imaging. These are the motivating factors for them to learn pathology. Impact of pathology specimen resources, make the sciences relevant to future profession. Usually chemistry, physics, they are not interested because I'm going to be imaging students. Why do I need to learn science? So here, the science that is relevant to pathology. So that's why they are interested. That's what they're saying here. Make the sciences relevant to my future profession. And want to learn sciences to understand medical imaging. Show stronger links between sciences and healthcare setting. Make it interesting to study sciences. So these are some of the some of the things that they liked, students liked. And another one, students, they said the way we are teaching now is more integrated, engaging, collaborative learning, is more meaningful, more interesting, motivating, memorable, and fun, and using for the future profession. So the summary: following the evaluation of these technologies, it was found that the high tech of technological resources and the high engagement are aspects of learning that were provided and balanced. Integrating technology, educators can take learning experiences to the next level for positive student experience and improved academic performance. At the end of each course, we do course evaluation. The university does it, and the evaluation for pathology was very low. It was 40. The mean value was 40. After introducing this integrated approach, the mean value went up to 84. So students started really liking it. We think they don't want to do the work, but it's all linked to the assessment. Only if it is linked to the assessment, students do the work. If it is not linked to the assessment, and no matter what you do, no matter how well you teach, they are not interested. It has to be really linked to the summative assessment. And the academic performance also was improved after introducing this method. Technology has made learning not easy, but it was a lot of work to transform those specimens into digital and provide all the information resources for each specimen. It was a lot of work, so it was not easy, but definitely it was interactive and interesting for students. But the whole approach, teaching approach, was based on this philosophy: tell me, I will forget. Show me, I may remember. Involve me, I will understand. Thank you.